looking for? No? Okay. Oh, aha, I see. Trying to throw me off there with the water bottle. I gotcha. So we're going to talk about the respiratory system today. Sorry, security's waving at me. Okay. And really, here's how the respiratory system works before we get into all sorts of other stuff about it. Just really simply, oh yeah, oh these are good, okay. All right, really, your lungs are this, and this is why you're not supposed to smoke and all that kind of stuff. And I don't care if you do smoke; that's your business. Don't let your clients smell it though. Clients hate smoke, but smoke all you want. That's your business. But shower afterwards. So, because we used to get complaints at the spa with our
national holiday.
Yeah, well, that wasn't quite what I was suggesting, but we get you. Thank you, Ms. Cooper.
Sorry, I caught the end of the convo, and I thought that's what you
heard smoke, and you've been on the 420 thing today. Yeah. Yes, that's my little stoner. I gotcha. Okay. Yeah. That's probably why you're getting off the call early today, huh? Okay. Anyway. So, if you have a really... Oh, wow, that is really hard to see. It doesn't really matter. But, if you have a really thin membrane, and you bring capillaries up to it, does not look at all like this, but if you bring capillaries up to it, the O2, the oxygen in the air, will actually kind of dissolve through this membrane and get into this capillary and get picked up by the blood. And the CO2, the carbon dioxide in these capillaries, will kind of leak out here. Because we are talking about things that are one cell wall thick, and they're actually made to kind of leak. So the membrane is too thick to let blood out, but it's not thick enough to stop gas exchange. And think about that. That's not unusual. There are lots of things that will kind of hold water, but that doesn't mean they'll necessarily hold air. So this thing is porous enough that it'll allow air to go back and forth between it, but it won't allow blood to go back and forth between it. And if you have a very big surface area like this, you can let lots of oxygen into your bloodstream to go through your heart, go through your whole body, and lots of CO2 out and breathe it out into the air. And so what your lungs did is your lungs are big sacs with little sacs and littler sacs in those sacs. And so what happens when you do something like that, your lungs wouldn't work really well if they were just a big bag. There's a big bag. Yes, air will go in and out of here. Yes, blood can come off that. Right? But believe it or not, you've only got the surface area of this lining around this bag. And if I open that up, that might be this length. But if inside this bag, you had lots of little bags, and inside those bags you had lots of little bags, now when you open this thing out, you've got something that covers a huge area. And if you have a huge membrane, you can actually have lots of passive oxygen exchange. And it is passive. You need it to actually kind of seep through and seep out and get into the bloodstream. Now your hemoglobin will grab the oxygen and take it, but it's got to be close enough to oxygen to get it, and you have to have lots of oxygen available. So it is, again, very hard to imagine. It is very hard to imagine, but essentially, when you put lots of folds in something, you can make something that's big very tiny, right? And so we think the lungs are only this big in here. We're like, but they're tiny. But really, they're all folded up. And the air can get to all these little pockets. And when we open it up, we find out it is much bigger than we thought. Now, had I done this demonstration with your lungs, the only difference would be I would have unfolded this to the size of a tennis court. Thank you. I needed somebody to make that look. So your lungs, they say if they truly were to open them out, really open. Your lungs in your body right now, the ones you're walking around with, would cover a tennis court. It's hard to imagine. But your intestines work the same way. They had so many ridges and stuff that if you open them up, they'd be huge. And that's how this works. So that's it. That's how your lungs work, honestly. We're going to talk about a little bit about some terminology and things like that. We're not going to go into gory detail. And we as massage therapists don't try to make the lungs work better. We try to make the rib cage work better so the lungs aren't impinged and can really open up. If somebody's lungs are actually messed up, if they have been smoking a lot and they've clogged all those little things, that's a whole other problem. Massage doesn't really help that. But massage can help relieve any tension around the rib cage so that the lungs can fully expand, so they can work to their fullest capacity. I'm pausing because I thought, Miss Estes, you were about to just click on the thing. Yeah.
I was, actually.
I'm getting good at this.
Yeah, well, so breath work, going back to breath work.
Thank you.
This subject, it was like the perfect day to do this demonstration. You know,
that's
like,
weird. Yeah.
who would have thought? Anyway, so massage, yeah, it can only do so much. I mean, it can get us breathing, right? But the breath work, if you're pumping a lot of oxygen and air through the lungs, that can really move some things. Like I had a lady who she did 3 minutes of this one lung opening exercise, just like spinning around with the breath, and she said that she coughed up a puff of smoke, and she was so surprised because she had quit smoking 5 years previous.
Oh, wow, that is amazing. I used to be a smoker, so I actually know that, but I've never had it like 5. I just knew that after I smoked a cigarette, if you asked me to blow out really hard an hour later, smoke would come out, which was pretty disgusting in and of itself. 5 years would be a whole other thing.
Yeah, it accumulated in one of the pouches or whatever, you know.
Hung out there.
Yeah, I mean, imagine that, holding that for that long.
But you do make a really good point too, which is that there are things that the breath work along with the massage could be very beneficial too. Because the breath work actually does work the inside of the lung. You're right. You're absolutely right about that. And increases elasticity. And lungs, by the way, everything in your body works on a use it or lose it principle. Everything. Your body does not like to not be stressed. It actually likes to be stressed and rest. Stress and rest. It doesn't do good with all stress, and it doesn't do good with all rest. And yeah, using your lungs like that could be very beneficial. Yeah, very cool. 5-year-old smoke. That's disgusting. I know I'm not supposed to say it's disgusting because it's the body, but 5-year-old, it just seems like it would be a little stale. Yeah.
Yeah. It was trapped in there. You know?
Yeah, like a little demon. Wow.
Yeah. Whoa. Well, yeah, and I mean, if you think about it, if we just breathe automatically and we don't, you know, it's just a default mode, and so we're just breathing shallow our whole lives. You know, I've heard the deeper the breath, the richer the life, and the richer the blood. You know, so we get, you know, it's all part of the healing, the body work, you know, the breath work and the massage, stretching.
I think you might have something that you need to incorporate into all your massages.
Yeah,
for you.
Yeah.
Like this sounds like the path you are going on. Yeah, being aware of all this stuff. I love that, and I would agree with that. Admittedly, I don't always follow it, but I would agree with the deeper the breath, the richer the life, the richer the blood. Yeah, I like that. Very cool. Thank you. Yeah. Okay. All right. Respiratory system. Boop. So anyway, we are studying this, by the way, again, because it's a system of the body, and we want to understand the general principles about how the body works. Like, if we don't understand there's a respiratory system, there's no need to loosen up the rib cage. I mean, that's not totally true. There'd be lots of reasons. But my point is just to understand what's going on underneath the skin, even though the main thing we care about is fascia and muscles and things like that. So we're going to talk about the respiratory system, which can also be called the what system. What is another word that I use for respiratory system? It starts with a P, and Miss McDowell's about to tell me right now.
Pulmonary.
Pulmonary. Pulmonary means lungs. So when people say pulmonary system, they mean respiratory system. Pulmonary means lungs. All right. Pulmonary system, here we come. Hopefully you can all see that. We're going to talk about some of the structures here. So, cells need oxygen. I realize this is a weird statement, but remember when I made the weird statement that you guys don't fart? I said, I always say it for effect because it's funny, but I said you don't fart, really it's the bacteria in your intestines that's eating the food, and the bacteria is what releases gas, and then it's inside you and you have to release it, but it's really the bacteria. Well, you don't really breathe for you. You breathe for your cells. You are responsible for your bodies, and it's your cells that need the oxygen. Your cells need oxygen to process energy. And without it, there's rapid cell death. They die. So without oxygen, without blood, there's pretty rapid cell death. In an area like a limb or something, that can be dealt with, depending on how long it is. If that's your brain, you don't have much time at all. So anyway, the real point of breathing is to get this air into my circulatory system so my circulatory system can get it to my cells. And yes, Ms. McDowell.
If somebody has like necrosis of like a bone, does that mean that it's not getting oxygen and that's why it died? Is that like the main reason? I
have no idea. I mean, obviously necrosis means the cell is, the bone is dead. The cells are dead. It means dead tissue. Mm-hmm. But we'd be speculating why it died. I don't know what typical reasons are. But removing oxygen from an area would create necrosis. That's for sure. I just don't know how common that is. I mean, I don't know if there's other common reasons, because there's other things that could kill off tissue, right? You could have some type of chemical imbalance in the area, things like that would kill off stuff. But I can guarantee you that lack of oxygen would create necrosis.
So like if a part of your lungs wasn't getting any oxygen, would that part of the lungs like die essentially?
Yeah, and that does actually happen with people where part of their lung gets damaged, and it's weird. The lung actually has to get oxygen and blood. It has to get oxygenated blood from the circulatory system, kind of from itself. You're right. And if a part of the lung is not getting that, yes, you get necrosis there. The more common thing is necrosis of the heart, where the heart has blood cut off to some part of it, and that part of the heart dies. And if it's a tiny little section, okay, but if it's a big section, you can't pump right anymore. That's the problem with heart attacks and such, is really, it's not just the lack of blood flowing and stuff like that. All the compressions and stuff like that can help with that, but it's the damage being done to the heart while the oxygen is not getting to it. So when you come back from a cardiac arrest, sometimes your heart has now been damaged. It's truly died, parts of it. And that is similar to necrosis too, right? Oxygen wasn't getting to it. So I have to say, necrosis caused by lack of oxygen is the necrosis I am most familiar with, but I don't know if it's the most common.
Okay.
Yeah. All right. So we are breathing just like we are beating our heart to get oxygen to our heart to get it to the rest of our body, to get oxygen into our bloodstream. And by the way, I don't think your book says it right here too, but this is super duper duper important. We always talk about oxygen, 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 but it's also a lot of it is to get CO2 out of your body. CO2 is a poison to you. So it's not a poison to plants, they love it, but it's a poison to you, and actually it's a bigger deal. CO2 will kill you if you get too much of it built up. And it's one of the reasons when you hold your breath that you really want to take another breath. It's your body's desire to get rid of the CO2. It's your CO2 alarms going off. Believe it or not your oxygen alarms going off. But same problem. Still need to breathe. Let's see. Yes, Mr. Brown?
CO2 is the same thing that comes when you leave the car on in the garage and it fills the house?
Well, there is CO2 in that, but there's also carbon monoxide in that.
It was monoxide.
Yeah.
They're different?
Yeah, and that stuff's really dangerous for you. It's even worse than the CO2, and that's why it's so dangerous. And the problem, by the way, with the carbon monoxide and CO2, both these actually, is when you're ODing on them, you usually feel sleepy. So the problem is when people don't know that that's what's going on, because you wouldn't necessarily know, they lay down because they're tired. And they could be laying down in an environment where there's lots of carbon monoxide and CO2, and that's how they die. I mean, assuming they didn't do it on purpose. Yeah. Anyway, yes, sir. Okay, so I'm going to show you a picture in a second to kind of put all these parts in place. But you have a nasal cavity, which just means a space behind your nose. You have a place called the pharynx. And the pharynx is kind of behind my nose and mouth. Again, I'm going to show you a picture in a second, I promise. And to me, it's a connecting zone between my mouth and my esophagus. It's kind of the place in back where your body decides if it's going to go down the esophagus or going to go down the trachea, right? And remember, my trachea is in front and my esophagus is in back. My trachea is my windpipe. My esophagus is my food pipe. So my trachea is in front, and there is a little flap that goes over my trachea called my epiglottis. Its job is to keep food from going in my windpipe. That flap is supposed to come down. Yeah, it doesn't always work as well as we'd like it to, as we all know when we've inhaled something. But it's supposed to go down and keep food from getting into your windpipe. And your body's kind of angled in a way, so it should go down your esophagus easier anyway. But occasionally, we're talking during dinner or whatever, and we inhale our food, literally inhale it into our lungs, and that causes problems, for sure. Yes, Mr. Blygen.
You said the epiglottis? Is that the dangly thing that's in the back of your throat?
No, I know what you're talking about, the thing hanging down like this. The epiglottis is further down, and it really is a flap over your trachea, over your windpipe.
What's the dangly thing in the back of your throat? You know what that means?
I know exactly what you mean. I'm sitting here searching my brain right now, trying to remember what this thing is.
Uvula?
Yeah, but what does it do?
Makes you throw up for gag reflex.
Let's see. Hold on.
What was the name of it?
It's uvula, U-V-U-L-A, and
It's a
I'm pretty sure, somebody should check me, but I'm pretty sure it's the uvula is made out of salivatory glands, so it does release saliva, but it helps prevent food from going up your nose. Food and drink from going up your nose. I'm pretty darn sure on that. I don't think we cover it in this section, but I'm pretty darn sure the uvula keeps stuff from going up your nose, and the epiglottis keeps stuff from going in your windpipe. All these dangly things keeping stuff from going places. Yeah. Cool?
Yes.
Thank you, sir. All right. And we will talk about the alveoli, which are the tiny little transferring air sacs inside your lungs. And there's so many of them that when you open up all the air sacs, that's why your whole lungs would cover a tennis court. We'll talk about those too. Let's see if we have a picture, because this is so much better with a picture. Let's see. Well, maybe not. Yeah. This is not a great picture. Hold on, let me go through a couple more definitions, because then we'll try to find a picture in this slideshow here. What does your respiratory system do? The main thing it does is exchange gases. The main thing it does is get O2 into your body and CO2 out of your body. It does help you with smell, which is called your olfactory, which is your sense of smell. And it's actually fed by your olfactory cranial nerve. It comes from your head. And of course, it helps with speech and sound making, all that kind of stuff. We use our respiratory system for that too. Yes, Miss Cooper.
I'm about to submit my kinesiology quiz.
Good, Miss Cooper. I'm very proud of you, but I'm right in the middle of olfactory right now.
Huh?
And by the way, she's talking about the largest test she has taken the entire time she has been here. It is the biggest test she will take and have to take. And if she does well on it, she won't have to stress about...
Oh, I'll do well on it. Let me submit it and tell you how I did. Hold on.
Right. Well, no, I got to get back to this lecture. Just submit it, and I'll look at it in a minute. I love you. But there's 24 of you. Bye. Just like my third child. Okay. So now let's see if we can find a picture of this thing. Your book has some pretty good pictures. This just kind of tries to explain the oxygen exchange and the little capillaries getting right next to the alveoli so that they can get the little oxygen out of them. It's just a visual of that. Probably better to look in your book for that. Let's see here. Here we go. This is what I was looking for. Okay, so we can see the epiglottis here. I'm going over it right here. And you can see how it would cover the glottis, which is the top of your windpipe, top of your trachea. And we can see in back is the esophagus. You know, so that food should kind of slide over that epiglottis that's closing down and should go down the back track. But if the epiglottis doesn't close down all the way or you're talking, that can be a problem. Yeah. We also see how much hollow space is actually in your sinuses up here and in your nasal cavity. And how big the tongue is, by the way. How much space it takes up. And we'll come back to this if we need to. That's it. Oh, and the pharynx, by the way, is just kind of this area here where your body has to decide between going down the esophagus or going down the trachea. Yeah, good stuff. Yeah, kind of, sort of. Did you have a question, Ms. McDowell? You have a very, okay. No.
I'm just thinking about how mine doesn't do a very good job because I probably choke on something all the, like at least once every 2 days, so it's not doing its job very well.
Oh, yeah, keeps life exciting. Does Mr. Mejia know the Heimlich maneuver?
He does, but he usually just pounds on my back till I start breathing.
Good. That's fine. I just want to make sure.
Whacking me, like in a nice way.
Right. No, I got you. Well, hey, like if you can't breathe, it could be even a mean way. Yeah. I got you. Okay. Interesting. Okay. Let's see. We are not going to get into all the stuff about the nasal passages and such. Let's talk about why you have a nasal passage, though. A lot of people believe that it's ideal to breathe through your nose, and that's probably true. There are some advantages. Obviously, you can breathe through your mouth, and it's nice to have that as a backup option in case your nose is stopped up or something. But your nose is considered to be the ideal place because it is better at filtering out dust and foreign particles. And it's meant to be a humidifier of air coming in before it gets to your lungs. Because your lungs do better with moist air. Because when the lungs are moist and the air is moist, the gas exchange works better. And so it's meant to be kind of a conditioning chamber to clean out. It's got mucus in there, right? It's got little nose hairs and all that kind of stuff. And it cleans all that stuff out before it gets into your lungs. And so it's meant to be kind of a filtering, humidifying area for your lungs. That's the concept of the nasal cavity. And it does pretty well doing that. And you guys all know that in your throat and such you have cilia, which is little hair-like projections in your throat. Yeah, it's kind of gross, huh? And the mucus is in there too. And by the way, part of what they do is bring the mucus back up. Because as it's catching all this stuff, cilia is meant to bring it back up so you can get it out of your body. Yeah. Just thought I'd share that with you. Yes. All that extra mucus production. Beautiful. Okay. You've got all sorts of sinuses. We don't think about this, but there are actually hollow areas in your skull. This makes your skull a lot lighter. And that would make sense that Mother Nature would want to make it lighter because it already weighs 8 to 10 pounds. And that's actually really a lot to carry on your shoulders. And so hollowing out nasal sinuses and such makes it lighter. And you've got a frontal sinus and a sphenoid sinus and an ethmoid sinus and a maxillary sinus. Your maxillary region is around here. Your frontal region is here. As we learn the skull bones, this will make more sense. You don't need to memorize the sinuses at all. Just be aware that there are hollow spaces in here. They are filled with mucus lining and mucous membrane. They can get infected for that reason. But that's what they're there for. They're really meant there to save weight in your skull. There may be other reasons we're unaware of, but those are some of the obvious reasons that we know that they're there. And here's actually a pretty good picture of little sinus locations. Yeah, kind of pretty. The pharynx is a tube that really connects your nasal cavity down to your larynx. And it really is your throat. So again, the pharynx is just where your throat and nose meet. And at the back where your throat and nose meet, as you saw back in this picture, in the back where your throat and nose meet is where decisions are made about whether to go down your trachea or your esophagus. And they just call this area the pharynx back in here. Yes, Mr. Blygen.
Pharyngitis and laryngitis is not cool. That's all.
Laryngitis and what else?
Pharyngitis.
Pharyngitis, not cool. You've had those, I take it.
Yeah, back to back. I don't know how that happened, but I had them back to back.
Actually, I'm not too surprised you had them back to back. Sometimes one infection leads to another. But it does not sound like fun. Yeah. I'm glad you're done with that. Yeah. And by the way, they name the pharynx in all these different ways. Like up the upper portion might be the nasopharynx, and the part that you can see inside the mouth, the oral part, is the oropharynx. You don't need to remember any of this stuff. You just don't. You're not going to be doing internal stuff in a mouth at all. But it is important to kind of know that the nose and mouth come together, and then there's a decision made back here about going into my windpipe or my food pipe. Or your drink pipe. Depends. Sorry, I'll never let that go. It's too funny to me. Can't do it. I know it's not fair. It's not nice. And then we talked about once it gets down into your larynx, which is really your trachea, by the way. It's just the top of your trachea. It starts at your glottis, which is the top of your trachea there. Remember, that's got the epiglottis over it that usually is like this, but it really can fold down over it. Stop you from swallowing food, at least most of the time. And yeah, some people call the epiglottis the guardian of the airways. I put that in there because your book put that in there. I have never once in my life heard somebody call it the guardian of the airways, but I believe them. I believe them. And then we finally get down to your official trachea. We've kind of passed your vocal cords, things like that. And eventually, your trachea will split into a right and left bronchial tubes, and the bronchial tubes go truly to your right and left lung. That's what they do. Miss Mares.
Sorry, no question.
Okay. All right. You sure? You still have your hand up? Change your mind? No? All right, so it goes into your right and left lung. These bronchial tubes go down in smaller bronchial tubes called bronchioles. Again, none of this will actually affect you as a massage therapist. It is interesting to note, though, what I underlined here, and I can show you a picture, I hope, in a sec to make this point clearer. But the right bronchial tube goes down a little steeper and it's a little wider. And so when you inhale food in the trachea, it almost always goes into the right lung. Because that tube just really invites, once you've gotten into the trachea, it really invites food to just keep falling down that way. So when they have somebody really inhale something big and they have to go in after it, that's where it usually is, in the right lung, because it goes down the right tube. You can kind of see this picture here. You got to remember it's flipped. This is for the client. This right tube, as you can see, is kind of a straight shot, which is on the left-hand side of this picture, a straight shot into the lung. So if you get stuff in the trachea, it tends to just fall down in this part of the lung. What happens to food when it gets down the lung and you don't cough it back out? You die. That's it. No, not at all. Don't worry at all. If you can keep breathing, because all of you have probably gotten a pea or something down. You've gotten some food down your lung at some point in your life, guaranteed. And if it's small, your body will actually eventually dissolve it. It's a foreign particle. It'll go in there. It'll slowly attack it, and it will slowly get it out of the lung eventually. So as long as you can keep breathing, you're good. Your body will get rid of that. You have gotten stuff in your lungs before. And think of all the other stuff your body, cleans out of your lungs. Like we mentioned smoking. When smokers quit, you know, if they stay alive and stuff, their body cleans out the smoke. It all goes away. That's what you do. Yeah, I'm sorry, that was a little morbid. Anyway, but you get the point. You get the point. I know someone in here swallowed quarters growing up. Yeah, I bet. Mr. Brown, you have your hand up. Is that just left over?
Sorry.
That's okay. I just don't want you guys to ignore it. Miss Cooper, you have your hand up. Is that left over? Miss Cooper. Okay. And Miss Montes, you have your hand up still. Did you have a question? Are you aware you have your hand up? No. Okay. Maybe. Miss McDowell, you have your hand up. Do you have a question, ma'am?
Yeah, so is my sister's, I don't know, ex-family member actually died because she was old and she like had trouble like moving, and she died because she asphyxiated like on some food, like it got in her lung, and then she got like an infection from it and she died from that.
Yeah.
Do you think that's just because of other underlying health conditions, not just the swallowing of the food into the lung?
Well, yeah, essentially. So, and again, I mean, I don't know all the details, but I can tell you this. You just said the swallowing of the food led to an infection.
Mm-hmm.
So it didn't go well. The body wasn't able to kind of deal with it. We don't know if the infection was because she had a compromised immune system, because normally your body would be able to handle this. So I would suspect she's older, compromised immune system, not enough movement. It all kind of sits there and festers. It's too late, and you know, that kind of thing. But I don't think it was I admit the swallowing of the food might have started the entire process, but it sounds to me like a lot of other things were compromised that allowed a piece of food to eventually be the beginning of the end.
But you're saying like a normal, like healthy adult, no problem at all.
Yeah. I wouldn't, my own child was sure they swallowed a pea or something. I would not take them to the hospital. I'd be like, you breathing okay? And they'd be like, yeah, it kind of feels uncomfortable in there, but I'm breathing fine. I'd be like, okay, see you later. Yeah, I wouldn't worry about it. Wouldn't worry about it at all. Happens all the time. Yeah. Miss Trotter. Hi, Miss Trotter.
Hello. So I don't know if you talked about it
Probably not.
already, and I missed it. But like, for asthma, are you gonna talk about that and like how that affects the lungs, or? 'Cause I know that kind of like restricts them more. Like I just had kind of like a random thought with it, and I was curious how that works with the lungs.
Yeah. So people that have asthma, and more importantly, asthma attacks, again, their body is interpreting pollen usually, or some annoyance, as a foreign invader and overreacting. And asthma can become scary when somebody has an asthma attack, because one of the things that happens is their throat starts to seal up a little bit. 99% of the time, if it's truly just asthma, even if they hyperventilate and pass out, then their breathing returns to normal and they're okay. So if it's just an asthma attack, and people that get asthma attacks will tell you this. They'll tell you they kind of just learn they got to kind of calm down and breathe through it. Maybe they'll have an inhaler and things like that. But in general, don't get me wrong, they might have to sit down, stop running, stop doing whatever they're doing. They might have to lay down, that kind of thing. But in general, it's not a big deal. That is different than going into shock from something where you're like anaphylactic shock, where your throat is sealing up and you can't breathe. And if you don't get some, get a shot of, epinephrine, thank you, epinephrine. Miss McDowell is telling me what to say, which I really appreciate, because I had no idea. When you don't get an EpiPen in you, then that can be really dangerous. But that's actually much more severe than an asthma attack. Asthma attacks are really kind of pollen related, and people return back to normal pretty well. But like a peanut allergy, anaphylactic shock, and you've got to get an EpiPen into them quick. But you'll know. They'll know. Yeah. Anyway. Yeah. Okay. How are we doing on time? Oh, is it time? Should we take a quick break? We're kind of at that midway point. I know your trachea splits into two tubes. your bronchial tubes, those split into smaller tubes called bronchioles. At the end of them are these alveoli sacs, which are these tiny sacs that let you exchange gas and let you get CO2 out and O2 in. And that's where the gas exchange happens. You may have, I'm just going to throw this in as a side note. Your alveoli are coated with these chemicals called surfactants. And surfactants, you'll sometimes hear this in medical stuff, that's why I'm bringing it up. Surfactants help the gas exchange happen better through a membrane. And so sometimes if somebody's having certain problems breathing and stuff like that, they'll supply them with certain types of surfactants to help this exchange of gas occur, which occurs better when you have these chemicals available. So I'm just throwing out a definition so you're aware of the word surfactant, not because I think it's going to change your massage career at all, but because it is something that is actually fairly commonly mentioned in medical terms, you know. And has to do with your ability to breathe, because it has to do with your ability to actually transfer the gas across membranes. Surfactants help do that. They actually reduce surface tension. Like, have you ever seen like a bug sitting on the water? The bug's sitting on the water because there's surface tension. Surfactants would make it so it sunk right through. It wouldn't have the surface tension. It would kind of be able to break through that first little barrier. Okay, your alveoli are these little sacs. They're made up of a basement membrane and a capillary wall, where there's the capillary wall is where the capillaries are, and the oxygen can come in and the CO2 can go out. Yeah, I underline that because I suspect it's going to be a test question, not because I thought it would change your life, which I often do. I'm sure you've noticed. Okay. I also underline if I think it will change your life, but you don't know which it is. So that way you pay attention. Yeah. This is super cool and kind of important to massage therapists. Your lungs are lined on the outside with two pleural membranes. A visceral pleural membrane and a parietal pleural membrane. And we talked about this with the heart too. Do you remember? It is a sac with serous fluid, which is kind of like synovial fluid, really. It's oil, and another sac around that. And all of this just keeps the friction from your lungs and your heart and everything like that rubbing together. This way you've got a sac around the lung, you've got another sac around that, you've got serous fluid in the inside, so when the lung expands and contracts, it's not rubbing itself to death on something. Yes, Miss McDowell?
Is the surfactant kind of like the oil stuff you're talking about now, or is that a little bit different? The same stuff?
Yeah, as far as I know, it's extremely different. Surfactants aren't oil-like. They tend to break down oil-like things, and they would be more likely to be some type of liquid chemical that actually breaks down surface tension. So if anything, they'd be the opposite of oil-like. Whereas serous fluid is like synovial fluid, which is in your joints. It is oil-like, and it's actually created by the membranes themselves. But it means that there's always this greasy fluid between them, so the two bags will slide over each other very well. And that worst case scenario, this bag might be stuck to this lung, and the other bag might be stuck to the outer wall. But those two bags have oil between them, so you never get this real true rubbing going on. Yeah, but no, surfactant reduces surface tension, completely different. Serous fluid is like oil. It is natural oil. I mean, it really is.
So similar kind of purpose, but different function. One's for tension, the other's for rubbing, right?
I mean, respectfully, I don't see anything similar between them. I see serous fluid as being very similar to synovial fluid, which is the fluid that builds up in all your joints. And synovial fluid is this oil that's actually in a synovial joint, which is almost all the joints we study. Almost all of them are synovial joints. Not all of them, but most of them are. And they have this oil in them called synovial fluid. Serous fluid is very similar to that. It is viscous, it is oily, and it's really meant to slip and not stick. Surfactant is actually a chemical that you would that you could spray on something and it would actually make it easier for stuff to pass through that membrane. So if anything, it breaks stuff down in some ways. It would break down oils and things like that because they'd be getting in the way of gas transfer.
Okay.
So completely different things. One causes a true chemical reaction change. Surfactant really causes a chemical reaction change. It makes it easier for gas to get through a membrane. Serous fluid does not create any change at all and acts just as oil. It's not meant not to react, actually, and just to keep on gliding along. Yeah.
Okay. Yeah. That makes sense.
Cool. Awesome. Good. Okay. We know about this, about breathing already. It is a two-phase thing. There is the inhalation as they were practicing today when they were making up their time in here. And the exhalation. Yes. I'm sure there was more to it than that, but that was part of it. And the diaphragm was the main muscle that controlled that. That is controlled by this nerve called your phrenic nerve that comes out from your cervical vertebrae C3, C4, and C5. And I threw this little bit of trivia in here, but you'll often hear our EMT people say C3 through C5 keeps you alive. And what they mean by that is a break in the neck at that area can damage the phrenic nerve. And if that happens, you can't breathe. So if they don't put you on an iron lung, if they don't pump oxygen into you, at that point you die. So they'll often talk about that with neck breaks. They don't want somebody to break their neck right there because C3 through C5 is where the nerves come out that control things like your breathing. And even though breathing is automatic, it's still controlled by muscles. And if the muscles don't get a signal to do their thing, they don't do their thing. And so you would actually suffocate even though you'd be surrounded by oxygen. So just a little thing. Be careful with your necks. And your medulla oblongata, which you may have heard about in a biology class before, it's kind of the center of your brain. Your medulla oblongata is this kind of base brain of yours. It's like your brain within your brain. And it controls things like hunger, reproduction, breathing, heart rate. It is truly the center of your brain. The stuff up here on top is where you think your really lofty, interesting thoughts. The thing in the center there is the thing that says, I'm hungry. I better eat right now. I'm too hot. I'm going to die. I need to cool down. I need to keep breathing. I need to increase my breathing because now we're running. It handles the most basic stuff, and it does it automatically very well. But that's what controls your breathing. Just kind of an FYI kind of thing. And what it does when you're holding your breath is it is actually sensing CO2 levels in your body and freaking out and going, we're about to die. It's getting toxic in here with CO2. We need to breathe. It's the thing that sets off the alarm. And it's actually setting off an alarm because of CO2 building up more than oxygen not being present, strangely enough. You obviously need to get rid of CO2 and you need to get oxygen in, but it's actually the CO2 that becomes the bigger danger in the beginning. There was a space mission like that, like Apollo 12 or something. They had some problems up in space. And yeah, they had to conserve oxygen, but their biggest problem was fixing the CO2 scrubber. They rigged it together. They actually got duct tape and stuff up in the spaceship and actually rigged together CO2 scrubber. I mean, they already had one, but it was broken to make a CO2 scrubber because they were slowly dying on their CO2. That was their bigger problem getting back to Earth. So, anyway. So people that learn to control their breath for a very long time learn to actually deal with the CO2 buildup and how to get rid of that more than getting oxygen in. Let's see. Boom, boom, boom. Compliance is a term that is sometimes used to discuss the ease that your rib cage can expand and stretch during inhalation. And so the big question is, what muscles could affect compliance? What muscles could affect my ability or my ease of my lungs to stretch? What could stop me from having ease of breathing? And I will wait for you guys to answer that. There are many answers to that question. And anyone you want to give me one and then somebody else give me another one? Mr. Placencia, please enlighten me.
I had two.
Two? Go.
It makes sense. The serratus anterior and the rhomboids.
Oh my God. Why do I love that answer so much? Sir, I love that answer so much because I actually just had this discussion with the other class, because I will say that to you guys like 35 times. Yeah, serratus anterior, and let's go ahead and throw in pec minor because it always works with it, but you are 100% right. Serratus anterior and the rhomboids actually build a belt around your rib cage. If they are tight, that is going to affect your compliance, your ability to have ease of expansion. Yes, serratus anterior, rhomboids, love it. Anything else that might be tight and affect my ease of inhalation, or anything that might, anything?
Latissimus dorsi?
Probably, sir, respectfully, probably not. It doesn't hook, I mean, I guess it just hooks way, way too low in your low back, and it goes out to your arm. Do you have a reason? Yeah, by the way, feel free.
The pectoral, one of them two, the major or the minor?
I would go with minor because it goes with serratus anterior, and it can too be tight, and it hooks to ribs. I guess we could argue pectoralis major. It's a stretch, but at least it hooks to the ribs. But pec minor, yeah. So rhomboids, serratus anterior, pec minor. I love it. Yes, Miss Vincent.
I forget the name of them, but they go in between the ribs, and
Yeah.
they're the ones you eat that are on, from an animal. If you eat meat.
Yeah, I appreciate you saying it even when you don't know it. But yeah, the intercostals. The
That's
interior and exterior intercostals. I love that. Yeah. Miss Sarno, did you have something too?
Yeah, I have scaling.
Oh, the scalenes. Actually,
Oh,
no. Your scalenes hook to ribs 1 and 2, and that actually could. Not in the way I normally think, but I think that's a good answer. Your scalenes go from the side of your neck, but they hook into ribs 1 and 2, and they can have effects with rib elevation, and that can have effects with breathing. So that would not be my first guess, but I actually agree with you. I mean, it's got logic to it. Yes, scalenes. Scalenes could be an issue, yeah. Miss McDowell, you have your hand up? Something?
Do you think maybe the iliocostalis, because it hooks on to some of the lower ribs, could inhibit breathing?
I never in a million years would have thought to say that, because I've programmed myself as a teacher to have certain set answers, right? But I love it. I love it for the reasons you just said. It hooks to the costals, and it hooks to my hips, and if it's tight, it can hold my costals down, and that can affect my breathing, and we've actually all probably experienced a really tight back where it kind of affected your breathing. I love that. I love that you added a new measure to this. Thank you. Yeah, I love it. Same thing with the scalenes too, where I was like, just wasn't thinking along those lines, but I actually think those are legitimate answers. Especially, by the way, if you rub their back and they're really tight there, obviously. Mr. Placencia, your hand up again, sir?
Yeah, that day that you did the rib stretch on me, I felt a stretch along my abdominals, so I'm thinking maybe the abdominal muscles.
Yeah, good point. See, again, I'm not thinking outside the box. You guys are. Yes, tight abdominals. Abdominals, what are they meant to do? Tie your ribs down to your hips. So any abdominal problem anywhere I could see would be a problem. Yeah, well said. Okay, those were twice as many good answers as I was expecting. So thank you. And by the way, we didn't even mention, but not because it's, but anyway, there was also the serratus posterior, superior, and inferior that affect rib expansion and contraction, just in case you want to throw those in there. But you guys actually gave better answers. Maybe we'll write a textbook next year. Yeah. We will. Yes, Miss Walker T.
Could the erector spinae really affect it much? I mean, they do hook onto the ribs, but would they really affect inhalation?
The iliocostalis?
Yeah.
Are you arguing with me and Miss McDowell? Because we'll take you out, man. Yeah, we don't know what we're talking about, but we'll do it. I love that answer. I really think that the iliocostalis by definition grabs onto the hips, and by definition grabs onto all 12 ribs. How can a muscle that grabs onto all 12 ribs and is meant to kind of pull them down in a way? I know it's meant to extend me, but in doing so, it's pulling them down. Yeah, heck yeah. That doesn't mean I'm right, by the way. That's just that I feel strongly about it. What do you think, Miss Walker?
I think that they could, I mean, I don't think they'd cause as much as some other things, but I think if someone's having a problem, it would be worth making sure you get after them too.
Yeah, and actually, thank you. You said that much more diplomatically. That's what I really think about all these answers. I thought every single answer was a legitimate place to check, right? Nobody said, oh, the calves. What, right? Like, that doesn't make sense. But you guys all pick stuff that would be legitimately worth checking in your massage. Like when you're rubbing somebody, be like, oh, that's weird. Their abs are really tight. That makes sense. Oh, their iliocostalis is really tight. Oh, that could be, yeah. These would be good things to start looking for. And I like that kind of thinking because that's what we have to do when we're in a room with somebody. Is we just have to start being like, what could this be? You know, and you don't have to figure it out. You just got to figure out the 15 things it could be and try to work on those, right? And so this is a really good starting space. Cool. All right. I have nothing to say about this slide except look at it for a second. Because it's an excellent example of how inhalation works. And remember what happens with that diaphragm, it's up like this. It actually comes down as it tightens up, and that makes the lungs come down. And that's why inhalation happens, right? So your diaphragm flexes and actually flattens, which brings your lungs down. And that's how inhalation happens. And then when it lets back, that's how exhalation happens, which is here. Easy peasy. Yes, Mr. Blygen.
So the lungs balloon outwards and downwards?
The lungs balloon outwards.
You said the lungs go down when when inhalation happens.
Yeah. Yeah, they do,
the
sir.
The lungs go down?
Yeah. They come down. Actually, the heart comes down with the diaphragm, really, and the lungs. They all kind of come down. The heart's kind of sitting on top of the diaphragm. And they all come down. But what it does, though, sir, is it increases the chest capacity and the lungs expand. So they would come down and out. Yeah.
Okay. Yeah, that's what I was getting at.
Yeah.
Because when we inhale, our body expands out.
Yes. Yes, thank you for putting it that way. Yes, when we inhale, our stuff expands out to create a vacuum inside. Yeah. Better said than I said it. Thank you. Okay. Oh, two types of respiration. This is going to sound really confusing but because of the way it sounds, but there's external respiration and internal respiration. They don't mean breathing in and out. They mean this. Just follow me really carefully. Like, look at me for a second. When I do external respiration, it's me breathing in and out with the outside world. All that was external respiration. When that wonderful O2 and CO2 and stuff is going through my circulatory system and goes down my arm and gets to my little cell here and exchanges gas with my cell, that's internal respiration. That's my cell breathing, if it makes sense. So external respiration is what allows me to have internal respiration. It's just a definition. But the reason it's important is to realize you're exchanging gas with the outside world so that you can exchange gas with your inside world. I'm just collecting a lot of gas here so I can actually have internal respiration. Internal respiration is the thing that saves your life. But you have to have external respiration to have something to share internally. So external respiration, some people call pulmonary respiration because external respiration I'm doing with my lungs. That's my lungs doing my external respiration, right? To get oxygen into my cardiovascular system, to take it to my cells, to have internal gas exchange, internal respiration with a cell. Yeah? Mr. Blygen, you still had your hand up, sir. Do you have more, sir? No. And that would be tissue respiration, where my tissues are actually breathing. And they really are. Where my individual cells are actually taking that oxygen out of the blood, using it, getting rid of their CO2, giving it back to the blood. That's internal respiration. Cool. Okay, couple of things like definitions about sneezing, coughing, asthma, things like that, and then we're done. And then we'll give you some quick homework, and we'll have time, and you guys will have a great night. Singing is in the air. I can feel it. Hang in there, Miss Morris. Well, you know what a sneeze is. But a sneeze is usually caused by an irritant, and the idea is that you're trying to get stuff out of your bronchial passageways. Usually sneezes are trying to get stuff out of the upper respiratory or the nasal stuff. Coughs are usually trying to get it out of your lungs itself, out of the lower stuff. Hiccups are spasms in your vocal cords and your diaphragm, usually. It's usually both. There's kind of a hiccup with your diaphragm and your vocal cords that kind of give you that neat little thing. And yawns, they still don't fully understand. They do seem to be connected with low oxygen levels. When your oxygen gets low a little bit, you'll be but it's funny, they're also contagious. Yeah. My mom told me when she was a little girl, she was in a movie theater once, and on the movie screen, the monkey yawned, and she yawned, and she turned around and looked behind her, and the entire movie theater was yawning. And that's when she realized how contagious yawns are. I thought it was cute, and I still remember that story. Okay, certain pathologies. Asthma. Miss Trotter, asthma we discussed is really, it's really just an asthma attack, and it's bronchial spasms, and they're spasming, which is different than closing, right? So it feels like you can't breathe, but you're actually able to breathe. You're just spasming, so you tend to, it feels like it's hard to breathe, but you're actually still breathing. And so that's why asthma attacks and things like that aren't usually as big a deal. Bronchitis, anything with itis on the end of it means what? If it's got itis on the end of it, what does it mean?
Inflammation.
Inflammation. Is this your sign from inflammation, Ms. McDowell? Because we gotta work on that.
The gets all angry and it gets swollen.
You looked happy and it did not look swollen. Like it's angry. Yeah, inflammation. By the way, guys, I keep nailing this stuff in because I guarantee you, somebody will come into your room many times and they'll be like, blah, 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 itis. And you'll be like, oh, so you got inflammation in your elbow. And they'll be like, yeah, how'd you know that? And you're like, I didn't. I just know itis means inflammation. And you said something like cubitalitis, and I know this is the cubital region. Like you'll put that together because you'll understand enough of the language. Because there's bursitis, tendinitis, ligamentitis, capsulitis. I mean, it just goes on and on and on and on. And at least it allows you to also sound a little bit smart too. You can be like, so you got inflammation of the what? I didn't quite catch that first part. And then they'll explain it to you in easy stuff. You're like, oh yeah, I'm familiar with that. Cool. Common colds are usually inflammations of the upper respiratory tract. Emphysema. The real problem with emphysema is they talk about the permanent enlargement of the airways and stuff like that, but that's not the problem with emphysema, although that does happen as your body tries to get more and more air in it. It's actual destruction of the alveolar walls, the little sacs. They actually get destroyed in emphysema. They lose their elasticity, and gas can't exchange through them. This is, I'm not trying to attack smoking today, but it's a respiratory system. Smoking definitely leads to emphysema. And what happens is those sacs, the membranes lose their elasticity. They used to be beautiful pink, and they tend to get kind of brownish and lose their elasticity, and gas doesn't go through them. The surfactants don't work very well. And so the airways start to enlarge to try to get more air in there and fix the problem. Your body does try to fix the problem, but it doesn't work. And emphysema is a permanent condition, really. And so it is no bueno. Not good. But from a massage therapy point of view, if they can walk in and see you, you're fine, because on the table, they're not going to be using more oxygen than they use to walk in and see you. So far, can you work on somebody with a common cold? Yes. It's actually not a contraindication. If they're running a fever, it's a contraindication. But if they have a cold and you don't mind risking it, I've probably worked on 1,000 people with a cold. I was happy to take their money and keep doing the massage. So all this stuff, none of this stuff would stop you from doing a massage on somebody, assuming they could walk in and everything seemed okay. But don't worry about colds. The real truth of the matter is we don't even worry about really, really low fevers. Like textbook, you know, if I open up a textbook, massage textbook, don't work on somebody with a fever. But the real truth is, low-grade fever, like you're a degree up, you feel fine, it's okay. You're a healthy individual, not too worried about it. Hay fever, This is people that have allergies. What you're thinking of is summer allergies, plant pollen. They love living in Arizona because we got 2 growing seasons, so they can go through 2 hay fever seasons here. Yes, Miss McDowell.
Is hay fever the same as valley fever?
No. No. Valley fever is something much different. Valley fever is kind of, by the way, I don't fully understand valley fever, but valley fever can actually be life-threatening. It's even life-threatening in humans, but it takes about 90 days to kill you, and you feel so bad that you go to the hospital and it's treatable. So they do stuff for valley fever that's quite treatable. Strangely, some animals, however, do not handle valley fever very well. So alpacas, little fun alpaca fact here, alpacas die of valley fever in 12 hours. And so for them, it's actually very serious because by the time the farmers figured out that they're sick, it's too late. It's too late to get a test to figure out. But if you and I get valley fever, we almost always survive because it takes forever for it to kill us. And by then we've gotten some kind of treatment or gotten better. But anyway, no, that's a true disease. Like it's not hay fever. They're totally separate. Hay fever is me overreacting to pollen. There's actually nothing wrong, and all my problems are symptoms of thinking there's something wrong. Valley fever is a true virus of some kind. I don't know anything else about it. Yes, Miss Crody, gonna tell me about valley fever? All right, tell us.
Yeah, we have the employee have the valley fever.
Yeah.
Mostly in Arizona. Some reason is in the dirt. There's like people like building a house, something deep, really deep. They come out of function.
It's a fungal infection.
Yeah, it's a fungal infection that comes from the dirt. And I know that like for livestock, they sometimes won't buy hay from Arizona because certain livestock will get the valley fever too, yeah.
Yeah, it's a lot of people got it. I have employee and a customer that they have valley fever. Some people really bad.
Yeah, and I've heard, I haven't done any study on this, but I've heard that most people that live out here have gotten it at some point, whether they knew it or not. Like, you guys are probably all immune to valley fever at this point. But, because I hear it's that common. It's in our soil, yeah. Cool, so it's a fungal infection, not a virus, huh? Fungal infection from the ground, right?
Yeah.
That makes sense. Cool. Yeah, I mean, not cool if you have it. And it takes a long time to get rid of it, doesn't it?
I think 2.5 months, 3 months sometimes. Yeah, depends. Some people have, I would have my employee, she have a different problem. So I don't know what happened later for the lungs. They have put some camera inside and it can take more longer. Don't know.
Could take longer.
Yeah, some people die.
Mr. Tate?
Yeah. Mr. Tate, please, sir, please add.
So I had 2 friends who had valley fever.
Yeah.
One day it was storming outside. It was really windy and dusty, and like an idiot, my friend, she was like, "Let's go play out there in the water and all that stuff," and she ended up catching it there.
Yeah.
And then my other friend, she was overweight. I'm not sure that had anything, and she was a smoker, and I think that's how it affected her. It was like Mr. Placentia said, it was a spore that got into her lungs, and she ended up going to the hospital. It hit her right away, and then another friend of mine, an older military guy, we were personal trainers together. He got valley fever, and it hit him pretty hard.
Yeah.
And it took months.
Yeah.
And he lost a lot of muscle, a lot of strength.
Sure.
He was a big bodybuilder guy, and it took him out pretty bad.
Yeah.
But he did recover. It just took a long time.
So all these people recovered, though, right?
Yeah, they did.
Yeah. Because I know it can be life-threatening, but I've actually never known anybody to die from valley fever. I'm sure it happens, by the way, but I hear in humans it's very treatable. Assuming, like you just mentioned, assuming that you don't have lots of other underlying issues. Yeah. Okay, so onward and upward here. Influenza is a viral infection. It's the flu, essentially. And highly infectious, but usually affects just your respiratory tract. And pneumonia. You've probably heard pneumonia you might have had pneumonia before I had it as a kid. But you'll often hear about it in older adults. It's very dangerous. So if it's often the thing that like somebody will be like, well, they died of complications of pneumonia, that kind of thing, because they had other stuff going on. So that's true. And then sinusitis. Itis again, right? Itis, inflammation of your sinuses, these hollow spaces inside here, and really the mucous membrane inside these hollow spaces in your head. Yes. You're killing me just now. I love it. Okay. It's like looking in the mirror. Okay. Anyway, that is that.